I'm going to mute everybody for now.
Oh, and just a heads up for anybody that's, when you're watching the Congresswoman speak, if you want to put it on speaker view, you might be able to see her a little bit better.
Perfect, thank you. Good evening, everybody. Thank you so much for joining us tonight. We have a special guest, Congresswoman Debbie Wasserman-Schultz on tonight. I'm Tracy Milgram Posner, the founder of BRCA Strong, where we empower, inspire, educate, and advocate survivors, and thrivers to eliminate the feeling of isolation and help you feel whole again. During COVID-19, we're sending out packages to women who are going in for surgery or who are just starting treatment. So if you know of somebody or a family member that could use this products and all the stuff that we have, please contact myself, Tammy, or Kate, and we'd love to get a package out. And what we do at BRCA Strong is we fund women post-mastectomy garments after they go in for a mastectomy or a lumpectomy for comfort, as well as, feeling whole. As all of us women go through different times, the different stages in our journey, I felt that one area that really did lack was support of your breast after a mastectomy. So I know Congresswoman has shared her story, but tonight I get to hear it one-on-one from the other side. So I really am thankful for your time and your support. And we look forward to hearing your journey and your inspiring information that you have and share. So thank you again for joining.
It's hard to say my pleasure, because I think all of us wish that that we were meeting under different circumstances. Would love to be able to meet you, for a different reason, but really, this is such an empowering opportunity for us to be able to come together and know that while you're going through the isolating experience of either learning that you are BRCA positive or combined also a breast cancer patient, it's a very difficult experience, and certainly breast cancer is incredibly difficult, compounded by the knowledge that that you're also genetically predisposed to not only breast cancer but numerous other cancers as well. In a COVID-19 environment, layered on top of that, it is made even more stressful. And being on for the last few minutes, hearing the the different stages of the process that many of you are going through, brings me back almost 14 years ago to the beginning of my journey. And some of you might have heard my story. I know Tracy has. As she mentioned, I always worry that overtelling it or repeatedly telling it is not helpful. But each time I share my story and the experience that I've gone through, and you never really are done with an experience like this. The journey continues, just in a different way, even when you're all the way through the other side. But each time I have an opportunity to share my story, I find that it's reached or helped someone in a particular way. So I'm glad to be able to be here with you for that purpose. In 2007, which was almost 13 years ago now, I was doing a self-exam in the shower. I did that periodically. I had just had my first mammogram, which came back negative, and no evidence of cancer, just some calcifications that weren't concerning, but the idea that there was a calcification kind of prompted me a few months later to do a self-exam, because I did that in order to make sure that I knew what was normal for me, so I would know when something felt different. And that's when I found the lump. I was familiar enough with what my breasts normally felt like, so that when I had something that had not been there before, I was able to detect it. It was less than half a centimeter, so it's kind of amazing to me to this day that I was able to feel it. Excuse me. And after a lot of evaluation, another mammogram, a ultrasound, an MRI, still being not entirely conclusive, they decided to do a biopsy. And after the biopsy, they, tested it, sent it to pathology. When I was coming out of the biopsy, they did the frozen section, and they told me it looked good, margins looked clear. And I went home thinking I was out of the woods, or likely out of the woods, and they always give you the caveat that, we have to wait for the pathology to come back. And 3 days later, I was at a holiday party, my staff holiday party, and Vivian was actually there. I got a call from my doctor on my cell phone, and he said the pathology came back. You have breast cancer. So, you feel like you have an anvil crashing down on your chest and a weight that is nearly impossible to lift. Last thing I expected to hear was that I had breast cancer, certainly at 41 with no family history, or at least no family history that really ever put, that I was ever able to connect the dots to. And I also was familiar enough with breast cancer, most breast cancers not being hereditary, so that it really wouldn't have mattered so much whether I had breast cancer in my family or not. To make a long story short, I went through as I was going through the process of, sitting down with the nurse educator, going through the whole evaluation of what steps we needed to take. I was stage 1A at the time, so very early onset, very small tumor. And the initial recommendation was just to have a lumpectomy and radiation, and that I would most likely be fine. Of course, once I sat down with the nurse educator and we went through the sort of cancer tree in my family, the amount of cancer, breast cancer or not, no one in my immediate family had cancer, but I had two great aunts that had breast cancer and had them also in their 40s. I had both my grandmothers had lung cancer. My mother's sister had lung cancer, which now we think was probably breast cancer that spread. She died when she was 32 in 1972. So a long time ago, when they didn't know much about it. And so the nurse educator said, this is a lot of cancer. You're an Ashkenazi Jewish woman. You're 41 years old and you have breast cancer. So that kind of had all the indicators that a genetic test was recommended. And, I had to go through the whole process of deciding whether to have a genetic test. The reason that they recommended it, obviously, as all of you have now been through as well, is because, even though I had early onset breast cancer and didn't need a lot of, aggressive treatment, if I had BRCA 1 or 2, the risk was more significant. The likelihood of recurrence was much more significant. The possibility of having ovarian cancer before I was 50 was very significant. So, I agreed, made sense to have a genetic test, went through the genetic counseling, which, I strongly recommend to anyone before you go through the genetic test. Don't send away for 23andMe. Much better to sit down and spend the hour and a half. It's covered by insurance, and you really need to go into that test with open eyes. It was extremely, extremely important and helpful for me to have a really good understanding, not just have my results mailed back to me. Just to fast forward a little bit. So they told me, it's possible that you have it, but there's a good chance you don't. It's the story of my life with every test I took. So, again, I was really not sure what to expect, but about a month went by. This was back when there were not any other options except the Myriad test. And so you had one shot, that was it. And so a month went by. I went back to my doctor to get the results. And I opened the door, and Tracy's heard me say this. I opened the door of the office and saw a whole lot of people in that room, way too many for the results to be negative. So I didn't even have to open the folder because I knew one person in the room, all good. 5 people in the room, not so good. So turned out I see a lot of knowing nods. So I was BRCA2 positive, and so that, as many of you know, made me susceptible to more cancers, some with higher risk than others, but certainly with ovarian, I already had breast cancer. And then they sat down and said, so remember how we told you that you really only need a lumpectomy and radiation. Now with this diagnosis, you may want to consider, and they gave me options. They said you could have a double mastectomy, which would make it even less likely in your lifetime that you have a recurrence, and that I would have less of a chance of getting breast cancer again than a woman in the population, the 1 in 8 women who are at risk normally. So that would improve my odds. I could have I could watch and wait, or I could go through with the lumpectomy, and or just have a single, only remove one breast. But really, the most piercing advice or caution was that they said, if you choose to watch and wait or only have more minor procedures, you're going to have to go through an MRI every 6 months for the rest of your life. And so that decided it for me immediately. I certainly wasn't going to spend my life walking on eggshells just to preserve my breasts. But I was fortunate because I was at a stage in life where I had been married for a long time. We had had all the kids we planned to have. I had breastfed my kids. And so it was an easier decision for me to just have the double mastectomy. And I kept it private. I didn't share it with anybody. I went through 15 months of surgeries, 7 surgeries in the course of that time, and eventually had an oophorectomy as well. And so I did that because, I really felt like, because as I said, cancer is such an isolating experience to begin with. You want to have some control over some aspect of your life. So for me, it was the information and who I wanted to share it with, and that being a high profile person, I didn't want, when a reporter would talk about me in a newspaper article, they would say, Debbie Wasserman-Schultz, and the rest of my name would be who's currently battling breast cancer. So that was just not an association that I wanted to have publicly. And then my kids were little. They were 4 and 8 years old. My twins were 8, my little one was 4. And, every association they had with cancer was that somebody died. So I knew I was going to be okay. I really was confident that I was going to come through the other side. So I decided to share it with them when I was, officially okay. And that was the right decision. I kept my circle very limited, only the closest staff and friends that needed to get me through it, just to share a couple of things, and then I'll be quiet. And if you have any questions, I'm happy to talk, or, we can just open it up. I remember when I went through the double mastectomy, so I was in the hospital, and I actually passed the legislation in Florida, the drive-through mastectomy bill, that, so I knew a lot about breast cancer. What was amazing to me was that after as much as I knew about breast cancer, not having had it, the fact that I didn't know as an Ashkenazi Jewish woman that I was 5 times more likely to carry the genetic mutation, and all the risk that came with carrying it, I realized if I didn't know, as knowledgeable as I was, I mean, look, I was doing self-exams. I was paying attention to my breast health. I got clinical exams. I did everything you're supposed to do. And so if I didn't know, I couldn't imagine how many women didn't know they were at risk. So I knew I had to do something about it when I got to the end of all that. And so anyway, just to tell you one quick funny story. So I have the double mastectomy. I do all my surgeries and everything in Washington. I'm recuperating. 9 days after my double mastectomy, I have a previously scheduled fundraiser for Nancy Pelosi, who was then the Speaker of the House. And I did not want to cancel it. I didn't want to cancel it both because I was very proud that I had worked really hard and it was going to be incredibly successful. And also because she knew that there's no way, unless there was something wrong with me, that I was going to cancel a fundraiser. So that I was hosting for her. So I made it very clear to the doctors that I needed to be ready to fly on an airplane home to South Florida, and they had 9 days. It's 9 days, period. End of story. So 9 days later, I was on that airplane, had a drain, still had one drain in, had that pain pack in the wall of my chest. So I was hardwired for sound. And what we did was I wore a very boxy jacket to the fundraiser. I got a mission bag, which I put over my shoulder. My intrepid staffer, who's one of my best friends, still to this day and still on my staff, she found a way to put black nylons and around fishing wire, around the wires that were coming into my chest, and threaded up through the jacket so that you couldn't see them, and I could zip the purse closed. And then I'm a hugger, so I usually would be walking around hugging everybody. And so I just kind of either hugged people very gingerly, or she stepped in between us, and, we ended up having a good handshake instead. So, but that all worked out. Everything was fine. And eventually I introduced the Early Act after I was all the way through my surgeries, which is, we're actually about to reauthorize before the end of this Congress. It'll be heard in the Energy and Commerce Committee on Thursday. I'm very excited. We've actually appropriated almost $40 million, and it'll be over $40 million in the last 11 years since it became law. 11 years since it became law. And it created a national education and awareness campaign targeted at younger women so that they would make sure that they knew what their risk was. But it also made sure it focused on women at higher risk who don't know, like I didn't. And like so many of you probably didn't. We could all swap stories for hours, I'm sure. So really proud that BRCA Strong exists. Proud of you, Tracy, for bringing this sisterhood, this important sisterhood together. This is a group we need to lean on one another. I'll just close with this. So I'm about to be a 13-year survivor in December, and that couldn't be more gratifying. I definitely look at life much differently than I ever did before. You're thankful for every day when you've stared your own mortality in the face. My twins, who were 8 years old, are now seniors in college. My little one is about to be a senior in high school, who was 4 when I went through breast cancer, and my girls, and this is so hard. I now I'm in a constant struggle with them over when they're going to get tested, because my oldest daughter's 21 years old, and she's known since she's 8 that she was at risk, and she wants to know, and she's an adult now. She wants to be able to control her own decisions. And I've gotten advice from my doctor that that's not information that she needs longer than she has to have it. And, I want to make sure that I help her make that decision properly. My 17-year-old daughter also wants to know. And now my brother, who just had a baby, his wife just had a baby, and she's 1. And so it had not even occurred to me, but my girls just talked to me about the need that my brother is going to need to get tested. My mother has the gene. She was tested after I was. So my brother will definitely need to get tested so that he knows whether his daughter is at risk. It's a wild ride, isn't it? So I'll tell you, no matter how confident you feel, you think about it every single day. I have the physical evidence of what I've been through that I see every morning when I get dressed. It's not something I can ever escape. You have to manage your mental health, and you have to lean on the people that you have to encircle yourself with people that have your back. And so I'm happy to be here to really help everyone just know that you're not alone.
Thank you so much for sharing and opening up to all of the women who are on the call. I know we have a lot of newly diagnosed women that are at BRCA and survivors or just BRCA. So I really appreciate you sharing, your personal journey, as everybody in life faces it, as we were talking, just a couple of things that maybe I can address. And then if anybody has questions, you guys can raise your hands. I was on a call with some physicians and I found out that in Florida, we have a 30% rate that is not getting mammograms. In just Florida alone, 30% of women are not getting mammograms. And I know we have this early act, and I'd really love to
All
figure
women, Tracy, or younger women?
all women.
Wow.
So, you know,
Where is
this,
where is
uh,
that statistic from?
I'll send it to you. I just did a call with Dr. Kalfa and Dr. Perez, and it happened
Oh,
to come up, and I was like, I was mortified. Like I couldn't even believe it. And I said, you know, there's so many resources out there, right? You know, we always focus on October. What can we do? What can we do? But
well, there's
obviously,
no copay. There's no
right.
copay for mammogram now. You
Where
don't, I mean,
can,
it's free.
I guess, you know, where can we promote to these women? Because I'd be a huge part of it. I do a huge campaign on here's mammograms. Let's do it. You know, where these women can go throughout South Florida, in Florida, where can we send them? Where can we guide them? You know, I don't know if you or Vivian or Michael or somebody could help us get that information. Because I'd love to promote it. I'm sure other women on the call would too.
Well, that's part of what the early act is designed to do, not certainly just exclusively focus on mammograms, but you know, the early act targets younger women who might wait too long. I mean, I shudder to think about where I would have been if I didn't get my mammogram right when I was 40, because you know, a few months later I was a breast cancer patient. So making sure that those education campaigns are comprehensive, and that where you know you're using the resources of this organization to help women understand. I mean, I am like a poster child for the absolute necessity of getting regular screenings, because even though my breast cancer wasn't caught by my mammogram, because I got a mammogram, I was aware and paying attention to my breast health. And I felt that lump. I don't know when I would have done a self-exam had I not gone and gotten the mammogram and had calcifications. You know, I don't know when I would have done that. And I don't know how much further down the road my breast cancer, it turned out I had ductal in my other breast. I had ductal and invasive in the breast I found the lump in. So we have to make sure that women are getting regular mammography and clinical exams too. That's really, really important, because the mammogram doesn't always catch everything.
Right. So that's one thing. And then the other thing is, I was going to tell you for your own personal use and everybody that's on the call, there's a platform called My Gene Council. It's $35 for the year. You take your genetic testing result, you submit it. Every time like mutations are found or updated to your BRCA1 or BRCA2, you go on there and they send you all the updates, like how to screen for pancreatic, colon, whatever's associated with that BRCA gene or mutation. And it tells you how to screen your children, when to screen your children, and there's a geneticist available at all times to call you. And it's $35 for the year. It's an amazing platform. I just got an update on pancreatic cancer, just like that there's still no official screenings, but if you're having symptoms, go look. So it's just a general database, and there's always geneticists available.
That's awesome. Well, you know, part of the early act included funding for a high risk campaign to help women be aware of their risk. It's called Bring Your Brave, the Bring Your Brave campaign at the CDC. It's funded by the early act, and the CDC. I just pulled it up on their website. There's a whole host of resources available on their website. Bring Your Brave.
Bring Your Brave. Okay.
The Bring Your Brave campaign is focused on BRCA gene mutations, raising awareness about women's risk of being, of being a carrier of the BRCA1 and BRCA2 genetic mutation.
Perfect. Thank you for sharing that.
Yeah.
Does anybody have any questions? Does anybody want to say anything? If you guys do, you can raise your hands. June, go ahead. You can unmute yourself.
She's trying to unmute herself.
There we go. Okay. One of the things I wanted to bring up was with the mammograms and women being able to get them. My daughter at 26, her general doctor said, hey, you need to go get a mammogram and ultrasound done now. We have a very long history of breast cancer, and we were already known that the BRCA gene ran in the family. She had the ultrasound, they found the lump. The doctor literally patted her on the knee and said, we'll watch it for 6 months. You're not high risk. Your mom hasn't had breast cancer. We didn't take that no for an answer. we basically were like, wait a minute. So he's like, you know what, fine, to calm your nerves, we'll do a biopsy. Well, guardian angels were watching because she ended up being triple negative invasive carcinoma at 26 years old. And of course, Mama Bear wanted to go back and visit the radiologist, and Cassie was like, no, Mom, positive energy, positive energy. The other thing with that, what I've just gone through in finding a lump, now I am a provider. I had prophylactic double mastectomy 3 years ago. I found a lump recently. And my general doctor says, okay, let's get an MRI. I'm like, great, you know, that's the best way to look. Well, I get there and they're like, okay, so we're looking for a rupture. I was like, well, what about the lump? Oh, you have a lump? Okay, well, he has rupture. No contrast. And in the report, it ended up saying protocol not, something to the effect of the protocol of the orders didn't allow them to look for breast cancer. And of course, without contrast, with implants, you're not really going to see anything. I was like, okay, so I just had an MRI for nothing. Luckily, I did some calling around. I found a very nice breast cancer out here in breast center in Maryland. And they're in the midst. I had a biopsy on Friday, and immediately I went in the one day and she's like, okay, we did talking. She did the exam. We went around the corner. They did the ultrasound. She says, let's schedule that. We need to biopsy that. A week later, they biopsied it, and now I'm just waiting. But the idea that because my daughter was 26, it was like, yeah, we'll watch. Triple negative, already invasive, carcinoma. If we had waited 6 months, I probably wouldn't have my 2 grandkids. By the way, yes, I became a grandmother again over the weekend. My daughter had a little girl. And yeah, so we're very excited about that. But, you know, it could have been a much different story. And it's just sad that even regular doctors, he felt the lump. My GP felt the lump and said, yeah, we need to get that checked out, but never reported it to the MRI and didn't ask for contrast. And it's just like, oh my word, you know my history. You felt the lump. I don't understand. It's like almost like doctors need to be retrained too on, well, without this or this, these tests don't help very much. So just
yeah, and that's
everybody.
Yeah. So one of the things that we did when we passed the Early Act, and it was really the breast cancer organizations that helped us write a bill that was going to really focus in on trying to make sure that the education programs that we created were going to fill voids. And so one of the things, you know, it's most education, you know, public health education campaigns target potential patients. What the Early Act did was it did that, but it also required the CDC to develop a public health education campaign targeting healthcare providers, because we found so many times, and all the stories that I kept hearing was just like yours, June, where, you know, the doctor that your daughter saw was dismissive. You know, you come in, she comes in, she has a problem, she's felt a lump, often with younger women in particular, you know, or, you know, women of different ethnic groups, women of color. It presents differently. It might not just be a simple lump. Sometimes it's, leaking from the nipples. Sometimes it's a rash. It just really depends. And educating healthcare providers about those warning signs, and educating them about different ethnic groups' risk, so that they aren't just dismissive, and you're not dealing with a higher mortality rate and more involved treatment. Back then, when we were dealing with when we were writing this bill, the mortality rate, particularly for younger women, had not gone down, even though the overall mortality rate for breast cancer had. So that's what we're trying to really address.
Well, thank you for that.
Thank you, June.
Go ahead, Tam.
If I can add something in, I have a question regarding the legislation that you're talking about. One of the things during my experience, I'm a 2-time ovarian cancer survivor, and I had a preventative mastectomy. I had some questionable lumps and things like that. And today is my mother's 5-year anniversary of her passing from cancer. It's very prominent in my family. My mother, my father, everybody has had some form of cancer. But I had a lot of complications with my surgery, and there was absolutely no physical therapy that was part of that experience. Like, I had a preventative bilateral mastectomy with deep flap reconstruction. And at no time was there any physical therapy that was provided to me by my physician. So the whole upper part of my body was cut open. And the first part of my procedure, I used to be very busty. And so I had to have a reduction first. After my reduction, I split open. One of my breasts split open. Then I had to have then I had the mastectomy, the remainder of my mastectomy completed at Memorial, which is a great facility. I had a great experience with them, with Dr. Bloomquist, but my deep flap reconstruction failed. So I was left with only one side of my body reconstructed, and the other half, I had I'm going blank for a second, an expander put in. The expander split open. And then I was left with one breast until I was able to complete my reconstructive procedure. And during my reconstruction, I had 2 infections and I was hospitalized. So I had a very terrible reconstruction experience and mastectomy experience. And at no time through that entire process did I have any physical therapy. And so I still experience a lot of pain, very limited movement. Thank God I have a very helpful daughter. I mean, you've seen me drag her around at political events, so you can imagine me dragging her around like in real life, helping me with everything. And I have a very good group of friends that were very helpful. I'm a single mom, I'm by myself at home, but my doctors, when I would approach them and say, is there physical therapy for this? Because all of these muscles are rejoining, and they tell you when you have a mastectomy, your muscles are reconnecting, but there was no physical therapy. The insurance doesn't cover physical therapy. There's no support for physical therapy. So I am still experiencing a lot of pain. And my last surgery was in August, September 1st.
They didn't recommend any physical therapy?
No physical therapy whatsoever. The doctor said it wasn't covered by insurance.
It's interesting as Tammy
not that they don't recommend it, just that it wasn't covered.
It's not covered, and they didn't recommend it either. Indicated? They said if you can do it. Well, it was kind of weird. That's the other thing. Different doctors, Dr. Bloomquist, who performed my mastectomy, recommended physical therapy. Dr. Barnavin, who was my plastic surgeon, who did my reconstruction, that I had all the complications with, did not recommend physical therapy. So it's conflicting the oncology.
You have to wait. I mean, I know, I remember when I had my mastectomy, I had to be careful about not carrying anything heavier than 10 pounds for 6 weeks or something like that. Yeah. So you can't really start physical therapy until after that process anyway.
Right.
And then there was the whole issue of being careful about, the edema, if they'd taken a lot of lymph nodes, which also they do recommend doing some kind of therapy, I thought. So
it's interesting that Tammy brings it up. I know that in our private group online, it's always a constant battle that it's either not covered or it's not recommended. Like, I feel like, and Tammy and I have had this conversation, a couple times in the group, and other girls, they think that there's such a lack of of guidance after a mastectomy, right? Like we focus, and maybe you can probably relate a little bit, you know, like when you go through a mastectomy, you go in, you go see the oncologist, you see the geneticist, you see your breast surgeon, you see your plastic surgeon, and then you're discharged.
Right.
But where's the guidance on physical
And then
therapy?
what do you, right.
You know, where's the guidance on post mastectomy wear? Where's that guidance? And I feel like, I mean, I can relate a little bit back to, I was diagnosed in 2004, pre Angelina Jolie, like way back. I mean, I knew since I was 21 years old, you know, I'm now 37. Things have drastically changed, but
Oh,
going through the process, you know,
during my time also.
it's just, I feel like, and there's nobody out there that could ever guide us to what we could implement, you know, to what we can
So,
do to help women.
so that's why I'm working on national survivorship legislation, because it's not just breast cancer, but in general, thank God we have had so many advances in cancer treatment that we have a lot more survivors than we used to back in 1972 when my aunt died, you know, at 32. And there is not a real protocol or a roadmap for survivors who are living way longer as survivors than generations of survivors before us. You know, so when you're in your 50s, 60s, and 70s and you get cancer and then you survive it, that's obviously a different stage of life than when you're in your 20s, 30s, and 40s. And so the things that you have to deal with throughout that your life, especially in that, you know, there's obvious fear of a recurrence. There are mental health issues. There are overall health. There's overall health guidance that, you know, unless you take the initiative right now to figure that out for yourself, there's not any textbook or even packet that they hand you that says, okay, so, you know, you probably want to avoid, eat better, you know, think about what you put in your body, manage your weight, you know, all the things that even that's normal health advice. There's no comprehensive approach to survivorship. And so there should be. And so I have been, and it's not easy because there's a lot of moving parts to survivorship. So we're in the process of trying to write a bill that will address that more comprehensively.
Perfect.
If I can just say something to that, Debbie, I'm really glad to hear that that's something that's happening, because especially for those of us on the call that are BRCA positive, you know, like I said, today is my mother's 5-year anniversary of her passing. My cousin Wendy is on the call, and she currently has breast cancer, and she's just a year later getting diagnosed. And so you're dealing with this constant PTSD of watching family members that are close to you pass away or experience cancer, and then your own fear of mortality and dealing with all of that anxiety. So I'm happy to see that that's something that's being addressed, because I feel like there's a lot of support for testing, and there's, you know, all these pink campaigns, and
we need insurance to cover it, Tammy. You know, I mean, so the problem is that there would be a lot more comprehensive services for survivors if they were covered by insurance. And so, you know, survivorship is, I mean, it's not a diagnosis, so to speak. So,
Right.
You know, so there's no code for survivor, and there's no insurance code. So we gotta make sure that we establish a protocol and services that are available to dealing with survivorship.
I'm interested. Let us know how to help. And
Yeah, if we can help out,
the
definitely
same
let us
to you all.
know.
Really, please we'd love to have feedback on some of the things that you feel like should be included in legislation like this.
Definitely.
I've not introduced it yet. We're still writing it. So
Perfect. If there's any way I could help, Tammy could help, we'd love to.
thank you. Vivian can connect you to my DC staff, and
Perfect.
we'll
I know
definitely.
Aaliyah.
Yeah.
Go ahead.
I have a question. As you ladies were speaking, everything just started popping in my head. So, Ms. Schultz, you spoke about genetic counseling as it pertains to BRCA. I'm not sure if I had genetic counseling. I just remember my gynecologist giving me my results, and she was by herself. It wasn't a room full of people.
Okay.
And but I knew it was serious because she wanted the door closed.
Yeah.
And moving forward, I had a primary doctor. Well, my gynecologist suggested I speak to my primary about my results, and then start speaking to all the other doctors that I was seeing at the time, which was a gastro doctor, just so we can start preventative care. And she also suggested I speak with my breast specialist because I had a previous breast issue dealing with the papilloma. So when I did speak with my
Aaliyah, did you when you got your BRCA test, did you already have breast cancer?
No.
So should they recommend a BRCA test for you?
I'm glad you asked that. Go ahead, Tracy.
Go ahead when you're done with
Okay. So what prompted the BRCA testing was I've been going to my gynecologist for years, and this one time I received, and this was a routine PAP, yearly exam. I received a form asking specifically about breast cancer history and family history. And it just dawned on me as I was filling out the form, oh yeah, my aunt Vanessa passed away from breast cancer. So once I got in the treatment room, my doctor, I guess once they got the form, they said, oh, she would qualify for testing. And I believe it was Myriad that I had the testing through.
Yeah, at the time, it was just that they were the only, they had a patent on the test.
So now this was in 2019. This was in February 2019. I was diagnosed with,
by then they didn't.
Now I was diagnosed with breast cancer January of 2020. So I found out I was BRCA positive last year in February, and I don't know if I actually had genetic counseling as it pertains to my results. I know she went over it with me, but I didn't speak to any specialists. So I'm trying to differentiate, because now when I go to the doctor, like if I go for ultrasound, which I went the other day, the question was there, had you had any genetic counseling? And I was
because what they said to me, Alina, was they really recommend, before they said you should have this genetic test. And I said, okay. And they said, now, remember, I already had breast cancer. So I was dealing with oncologists by then. I was, it wasn't a gynecology, it wasn't like sort of that basic level of healthcare. I was already with an oncologist. So they said, in order to be able to deal with the results, it would be, it's highly recommended that you go through genetic counseling so that I would understand all of the ramifications that the results meant. And then also, by the way, when you are given that information, who you share it with, making sure that you can protect it, because there's a federal law that prohibits your genetic information from being used against you, but it doesn't cover every aspect of your life. And so making sure that you're careful about who you share your genetic status with is important, because it can be used against you. It can't in insurance coverage, but technically in hiring, it is a potential risk. So I'm not a genetic counselor, but I would recommend, there's nothing wrong with going and getting the genetic counseling post results, because you would still benefit from that information.
I mean, I need to be able to have a conversation with my family. I'm very limited on my knowledge, and thanks for this type of organization and everyone like you and other doctors and stuff that come on, well, the doctors that come on, that I'm enlightened. I get this information. So now I'm like, well,
going through that genetic counseling really helped me understand about, who I should, like in my family, who I should share it with. I mean, just things that would never have occurred to me. I had daughters, but they were little, and I've spent their whole childhood now worrying, okay, like when am I gonna help, counsel them to go get the information that they need. But having that genetic counseling gave me a much more significant ability to give them guidance and to know where to seek information to help them.
Who does the counseling?
So, Aaliyah, what you could do is you can go, we'll talk after the call because you definitely
Okay.
didn't have it 100%. I know you
Okay.
didn't have it. I know everything.
Oh,
You know, you knew who you saw. I know, now I know it all. No,
thank you, because girl, you know, once I get enlightened, I ask questions. I have no shame.
what you need to do,
That's why we're here.
you could go on My Gene Council. That's one way, and you'll get direct access to Ellen Metloff. She's the first geneticist at Harvard University. She's awesome. She's the one who put the platform together. She's actually speaking in September on BRCA Strong about the platform. So you can talk to her, or we could get you in with the local geneticist. Either way, but I mean, you could do either option, but I will talk to you about it and give you all the information. But the biggest problem, you know, like what you said, and we can end on this note, is who's ordering our genetic testing, right? Like, hate to say it, OBGYNs are not geneticists. They're not focusing on genes and mutations. And the problem is you have family internists, OBGYNs, you know, these family doctors should not be ordering genetic testing. They cannot give you.
They should refer you. They should refer you for genetic testing so that you can go through a process with experts who can take you through the steps necessary before you go through that process. It's not a small decision, you know, it's really not.
And I think a lot of people just realize, hey, you want to get genetic testing? Yeah, but they don't know their risks or their reasons.
Like I won't use 23andMe because I just won't. Besides that, I'm a public figure. I don't want all my information in some database that, you know, I don't have control over. So,
you know, Color is a company also. I don't know if you're familiar with them. They're very similar to Myriad, exact identical mutations. They actually redid my genetic testing for me and ran it. And I had this identical mutations. Everything was the same as Myriad. And they call you over the phone with the geneticist. Lily did a presentation a couple months back about genetic testing and how it's so important that you seek a geneticist or a genetic counselor so you can get the right guidance.
Yeah, absolutely.
So go ahead, Kate.
Well, all my surgeries were at Sylvester, and they gave me a geneticist doctor. But as Tracy knows with me, I just wanted my surgeries and to be done. And I was like, why am I going to sit here and talk with this lady now when I just want to get my mastectomy, my ovaries and tubes out, and worry about that later on? So that's what I did. I kind of like brushed off the appointment with her. And I never went back to think about it, which is true, though. I should.
Because there's so much more than just breast ovarian, you know, and that's what
it is. And my grandma passed of pancreatic, but she had breast cancer in her 40s.
But remember, there's a slightly, I don't know whether you're BRCA2 or BRCA1, but I'm BRCA2, and there's a slightly elevated risk of pancreatic cancer with BRCA2. So, and I only know that because I went through that genetic counseling.
Right. So I need to go back and
you should
go through all that.
Not to be your Jewish mother or anything, but you know.
Well, my Jewish mother had breast cancer at 70, had a lumpectomy, did radiation, and found out she was BRCA positive. She did nothing about being BRCA positive except you and your brother go get checked, and we're both positive. Wow. And my cousins and my uncle got checked, and none of them were BRCA positive. So it was like my mom and me and my brother.
My mom is BRCA positive also, which I told you she found out after I was diagnosed, and she's never had breast cancer. She had lung cancer, but she's never had breast cancer.
Right, it's strange.
It is strange. It really is.
I want to thank you so much for coming on the call, and we appreciate your time and sharing your story.
Thank you.
It's good to see you via Zoom. Normally, you know, we
good
have
to
our
see
events. So again, thank you so much for coming on to BRCA.
Wait, I want to hear from Tammy's daughter because she's been chomping at the. So before I go, she really seemed like she wanted to say a couple things.
You want to say something?
No, is that my imagination?